So we just call it EMDR for short for that reason. And it's something that's really important right now. And I'm so excited, like I said, to be offering it in our practice because people are experiencing so much stress.
Mm-hmm.
They're feeling very anxious about what's happening in the world. They might be feeling stuck because they've experienced a job loss or fear around their health. I mean, there's just so many things that this is a therapy that can help you with. So very excited to talk about this today. So you're ready to give us the breakdown here?
I am ready.
So let's see here. We looked at some scientific studies that we're going to be sharing in the show about how EMDR therapy works and what the research has shown us. But I've also seen a lot in the news and just pop culture of celebrities who are starting to talk about the work they've done in therapy using EMDR. And one of those people who I came across is Rachel Evan Woods, who is an actress. And she had this to say about her experience. She says, I just started EMDR, eye movement desensitization and reprocessing. It's a kind of trauma therapy, and I must say it is absolutely fantastic. Crying has never felt so good. For people struggling with their past traumas or for PTSD, which is post-traumatic stress disorder, I highly recommend this intense but very effective treatment. I've been through a lot, but my eyes are clear and hopeful. Also, no shame in getting help.
Yeah, exactly. And that's an important piece, right? When we finally get to a place where we know we're stuck, we know things aren't going quite right with inside of ourselves. You know, trauma has a big impact. It really can affect the way we connect with others and the world and how we view relationships with others and the world. So, and always remembering to show yourself compassion around that, but also knowing when it's time to maybe get more help. And I really love that quote by the actress that you were talking about. And I think she's also a producer, you know, really diving in. And like she said, crying never felt so good because she was releasing some of that, right? So the past will always be there. And we have to remember that. But it doesn't have to control us anymore. It doesn't have to be a barrier for how we connect with others and ourselves, right? Because we believe a lot of things about ourselves after we have traumatic experiences. So I'm a failure, I'm worthless. All of that we can learn through trauma. So when we explore those things in EMDR, it can be difficult. We can cry. But that's the release of the control that it has over us. And it's really an understanding process of, okay, this is what happened to me. This is how I can reframe it, reprocess it, and integrate it in a way that is functional for us. So thinking about a filing cabinet, right? So we are storing trauma in a certain area of our brain. Maybe we don't want to look at that, right? Because we don't want to have those feelings. Those feelings are scary. But taking that folder, looking at what's inside of there, and then putting it in the right place, integrating it in a way that is healing for us, that it doesn't affect us anymore in the way that it does now.
Yeah.